at Green Dental Care, our practice, we treat patients all the way from the age of 1 year old to, 100 years old. So it's a family practice where we treat all ages. And, you know, keeping in mind kind of long-term oral health, the advancements in dentistry have allowed us to know that prevention is the best way to get ahead of dental problems. So it starts at a young age and getting the kids and the parents in the right mindset. And what we'll tell parents is, bring your child in at 1 years old, just to take a peek. And we're usually not going to do much, but our biggest thing is we don't want to create a fearful adult patient, which it starts in childhood. Most people that have a lot of dental anxiety, it started from a bad experience as a young kid. And so from there, usually we don't clean the kid's teeth till around 2.5, 3. They come in with their parent, their mom or dad. They sit there and can watch and see like everything's okay for mom and dad, so it's going to be okay for me. And we keep it fun, but really at that age, it starts at home. Are we eating the right foods? Are we avoiding sugary drinks and sugary foods and candy and things like that? Are we brushing twice a day and flossing? So it's home care. Like we see the patient hopefully twice a year and not more often, because usually if it's more often, that means there's something going on. But really, I heard a long time ago, like that there is no reason we should ever have to have a cavity if we are getting rid of the sugar that's in our mouth and drinking enough water and healthy foods. And I believe that's true. It's hard, but it's not, but it's possible. But that's really not the reality for most people. So, as we get older, there are different uh, demands and recommendations on maintaining our teeth because a, we're living longer as a society. So I like to say we're kind of outliving our teeth as far as how they were designed. So we really have to take care of them for the long haul. And when you get into the later years of life, we dental care 50 years ago, which is when a lot of our patients were kids, was a lot different than it is today. And a lot of it was drilling and filling cavities. And so now people have big fillings and crowns. And we want to, our goal is to keep teeth as long as possible and to save teeth whenever we can. But luckily, we have options like dental implants that can replace teeth where you don't have anything coming in and out of your mouth. And so it's a case by case basis, but comprehensive care for all ages is really our goal and what we specialize in. Parents always want to do best by their kids, right? And I think there's some stress as a parent to try to do everything perfectly, everything exactly as best as we can in all domains, right? And that can be hard, and we're putting a lot of pressure on ourselves. But as far as oral health's concerned, let's remember that if a kid gets a cavity, it's not necessarily our fault. There are some genetic components to this. We pass down germs and the pH of saliva, uh, and sometimes our oral health can follow the oral health that our parents had, right? But yeah, luckily nowadays we have better prevention modes of prevention and things like that. But I think if you want to keep it really simple, it's just making sure that the child is being seen by the dentist twice a year, and then really at home, uh, that's where it starts. Like eating the right things, not drinking too many sugary drinks, drinking water, brushing teeth twice a day, especially when they brush before bed. That's the last thing that's done. We can't be eating after we brush before bed because then sugar is going to sit on the teeth, and that's where issues start. And then flossing, I think once a day is pretty ambitious with having kids myself, but at least a couple times a week to make sure there's not just chunks of food sitting between the teeth, because kids are probably not going to let you know. The most common mistake that adults might make as far as their oral health is just not remembering the little things, like drinking too many energy drinks with sugar or pop, and then letting that sugar and acid sit on our teeth. That's going to cause big problems. But then aside from that, thinking that, oh well, I don't need to go in every 6 months, or I see the dentist once every 5 years and I don't have any problems, nothing hurts. So I think the thought process that nothing hurts means nothing is wrong is the biggest mistake, because by the time it hurts, it's way more expensive. It's there's a chance we won't be able to save the tooth. And had we just caught that problem in its infancy, it wouldn't have been a big deal. It would have been way less expensive, and we never would have had to experience pain. But we can't get ahead of it on our own, because at at home we don't have the diagnostic tools. We need a dentist or a hygienist to be able to inform us about the conditions in our mouth, or things that might be just starting. And like I said, catch those things in their infancy. So that's the biggest thing. Going to the dentist, really can be stressful for a lot of people. As far as measures that someone can do on their own at home to help their kids be less stressed about it, or themselves be less stressed, we could get into a little of that. But also, we do offer for adults that are highly anxious, and maybe they had trauma at a dental office, as a kid, or whatever it may be. We do offer different sedation types to help them forget the procedure or be really relaxed during the procedure, and allow them to get the dental work done without having to be scared of, let's say, a shot or the drill or whatever, the most common things. And even saying those words, maybe I shouldn't say those, but that's the reality. That's what we're scared of. And I think a couple things is, dentistry is so much different than those days. We have a lot of techniques to mitigate the pain, and make it more comfortable for our patients. As far as things that can be done at home before coming in, I think for parents, talking to kids is just kind of making it exciting. Use bribery as needed, but we'll but we'll make it fun for the kids here. And we talked earlier about just exposing kids. So see, show, do kind of thing. So watch mom and dad get their teeth cleaned, um, demonstrate what we're going to do, show them we're just going to tickle their teeth, and you know make it kind of fun, and not overdo it at the first appointment. So if a kid is just not going to open their mouth, that's fine. We're not going to push them. We're just going to meet them where they're at, and maybe the next time it'll be a whole different kid, because brain development takes time, and kids change very quickly. So our goal is to not to meet everyone where they're at, and not force anything upon anyone. As for adults trying to prepare to come to a dental office, I think just come with an open mind that the experience is going to be different than your last experience, and in a positive way, and that the first appointment, you don't have to do any dental work, but get your foot in the door. If it's been a while since you've been to the office, just come in. Let's just, at a minimum, look at the conditions in your mouth and just inform you. And then we could talk about your options to make it most comfortable for you, so that things don't get worse over time. So many of us are busy that the dentist could feel like an afterthought or an obligation, or be like, how am I going to fit this into my schedule? We offer convenient appointment times. So we do have some appointment times that are before work and school, some that are after work or school. We are open Monday through Friday. Tuesdays and Wednesdays we're open 7 to 7 p.m. We have we have a few different dentists here. So if you align with one dentist more than another, or one hygienist more than another, we can keep you consistent with that person. And so as far as being flexible, I think we're pretty flexible, and I think that it once it's in the schedule, it's easier to keep, right? So if we're just like, oh, I have to call the dentist, I have to book an appointment, even if it's a month out or 2 months out, get it on the schedule, mark your calendar, and then you can work around it. I know easier said than done, but it's really important that we keep our appointments when we do book them, because there's a lot of other patients that want to get in. And so when somebody cancels last minute, that's tough, because there was another person that we could have helped out. And so I think a lot of people working remotely these days. I think schools are more understanding if we have to take a kid out of school a little early, or bring them in a little bit late. And then working remotely, usually you could work around that, pop over to the office. We will be efficient and on time. But if that doesn't work for you, then we do have those early and late appointments as well. Preventive care it changes over time. I mean, the principles are the same. There's not a lot of new, brushing and flossing is basically the basic thing, and then watching our diet. Okay, what we put in our mouth, and how long sugar is going to sit on our teeth and things like that. I think there's been some headwinds with energy drinks and Mountain Dew. Those things can really destroy teeth with the acid and sugar. So really being conscious of how much of those things we're drinking, even Gatorade, and sports drinks. I think the as a society though, we're pretty conscious of that these days, and we understand when we're when we're eating or drinking something that's good for us versus bad for us. But as far as how things change as we age, sometimes as we get older, we need to have our teeth cleaned 3 or 4 times a year rather than twice a year. That might be one thing that I would point out. We may need to, if we have a lot of crowns or a lot of dental work, we may need to consider fluoride once or twice a year to protect around that prior dental treatment to prevent cavities from getting under that dental treatment. So the fundamentals I think are the same. We don't need to reinvent the wheel, but it's really about discipline and what you're doing at home too. I think another thing is to kind of know your own dental history, and know what's worked for you or hasn't worked in the past, and ask if you've had a lot of dental work done or have had deep cleanings before and had issues with gum inflammation and that, get the advice from your dental provider and then implement what they're recommending. Because we have seen people that have had, especially with like gum infections in the past or bleeding gums and things like that, we have modalities like Perio Protect and things like that are very simple, non-invasive. They can be done. It's a little teeny bit extra work, but with massive benefits. For a dental office to truly be able to treat a family for all their dental needs under one roof, that means that you probably have a few different providers with a few different skills. So a few different dentists, maybe one of the dentists is more experienced surgically or with implants. Maybe there's a dentist that's just really good at the bread and butter stuff, or maybe they're all able to provide a lot of different procedures. And so we pride ourselves on taking a lot of continuing education, having a lot of experience on things like root canals, Invisalign, wisdom teeth extractions, implants, veneers, all those things that sometimes could be passed off to the specialists. And don't get me wrong, we utilize our specialists. They're experts in their area for a reason, but we also can 90% of the time serve the patient at an extremely high level with some of those more advanced procedures. The other benefit there is patients are familiar, once they get familiar with our office, there's a certain level of comfort. And if we have to refer people around town to different offices all the time, they have to fill out new paperwork, they have to figure out directions to the office, they have to meet new people, deal with a new insurance coordinator and financial arrangements. That's could be very stressful. Whereas if I could just say, hey, Mrs. Jones, we could take care of that here. There's already a relationship that I have with Mrs. Jones. She's already an established patient. She knows how to get here, and it's just a lot easier on her. It's a lower stress, lower barrier to entry for them to get the work that they need done at a high level.